Most common and most overlooked health concerns. While many people brush them off as maybe stress or dehydration, frequent headaches can often signal something else, maybe an underlying medical issue. So we have Dr. Vij with us this morning, the Division Director of Headache Medicine at the University of Cincinnati Gardner Neuroscience Institute, kind of breaking down what we should know about this. I talked about the Neuroscience Institute being at the forefront of a lot of technological advances. You guys are doing good stuff there. Talk about, addressing headaches. A lot of people have that.
Right. So, no, thank you for having us. The most important thing when I tell people to think about headaches in two aspects. One we call as a primary headache disorder, where headache itself is a problem, like migraine, cluster headache, tension type headaches, or a secondary headache, which is where headache is a sign of something else happening, as you just alluded to.
Sure.
It could be a tumor, infection, stroke. That's what freaks people out. And that's where I think people need to kind of pay attention to things. It's not like it's a crystal ball that you can always tell it's a good headache or a bad headache, but it helps if you know few things. Say, for example, if a headache starts suddenly, it goes to severe intensity in less than 1 minute, what we call as a thunderclap headache. It's a dangerous headache.
Okay.
You don't want to ignore it. Second would be like if somebody who never had a headache and suddenly this is the first headache, the worst headache of the life, you don't want to ignore it. Doesn't mean it's always bad sign, but it could be a false flag at the end of it. But I would rather be err on the side of caution.
Absolutely.
Right? Certain other things, headache during pregnancy, you probably don't want to ignore it. Headache which is positional, like it gets worse with, sitting up or standing down, and a significant change in the position kind of precipitates it. Then there are things like if headache progresses, like you knew your headaches, but this headache doc is different. Those are kind of red flags, what we call in our language.
Sure.
You don't want to ignore those.
Well, and that it's something out of the ordinary. Of course, as you mentioned, with people that deal with frequent headaches, that can be a whole nother thing. But if something catches you off guard that you're saying, this doesn't feel normal, or this is excruciating, as you mentioned, really quickly, we got to get to a doctor.
Yes, yes.
And would you say, in that case, call your primary care physician, or if you're if something's off, go to the ER, or what's your suggestion?
So coming back to the same, headaches can change with different speed and intensity. If it's a thunderclap headache, I would re-emphasize again, if it is getting to the most in less than a minute, you don't want to call anybody, you want to call 911 and go to the ER. Now, there could be other situation where it's gradually getting worse. It's fair to kind of discuss and bring it to attention of your primary care provider as a starting point, or even reach out to a headache specialist.
Sure.
Fortunately, we do have options here in the city.
Well, and talk about that too. And as we wrap up, I think it's important to note that if people are dealing with head issues, you guys are at the forefront of, as I mentioned badly, technology and everything else. You have the most specialized care right here in Cincinnati.
That is correct. So headache management is like any other chronic management. It's not just about medicines or procedure, which we do, by the way.
Yeah.
It includes a lot of things beyond it, which include comprehensive care, means lifestyle changes, which starts with the person at home, not just at the hospital. Then we do have ability to rescue people. What I call is, not every time when you have a kind of worsening of your migraine, you want to go to the ER, because that's obviously not a fun place to be anyway.
Right.
We do have infusion centers. We can do that. And then there are some secondary headache disorders, what we call as, pressure-related headaches. High pressure and low pressure of your CSF, or cerebrospinal fluid. We can do those things also. So basically, even though it's very complex to take care of any chronic illness, and it's kind of a teamship with the patient, right? It's not like I can alone do it, because they are expert of their life, and we just one piece of the puzzle, and we want to bring all the resources to them. And fortunately, we do have, and we serve at multiple locations for the service of the community here.
The importance of multidisciplinary care. Doc, thanks so much.
Thank you.
Appreciate your time. So if you want any more information, UC Health has you covered. Thanks, Doc, for your time.
Thank you.
We'll see you guys back in 2.5 minutes. Stay with us.